welcome to OET Writing Live session presented by Tiju's Academy, and my name is Aishwarya. How how are you doing? How you all are doing? I hope you people are having a great day over there. All right. Yes. I hope everyone's OET preparation is going good with all your other three modules. So today we're going to deal with writing. So I hope the rest of your modules, you people are preparing in their full stretch as well. Yes, Akshaya, hi, very good evening and welcome to the session. Hi Tessie, Biji, hi everyone. All right. Yes, only good afternoon. Good afternoon to people over there. All right. So very good evening to each and everyone out there. Hi, Infach Leben. Hi, good evening. Good afternoon, Tintu. Good evening, Liba. Yes. I'm just taking my couple of initial minutes so that our usual participants can join our session. All right. Yes, Manju. Hi, Sony, Manju Thomas. Very good evening. All right. Hi, Parvati. Hi. Hi to each and everyone. All right. Hi, good evening, everyone. I'm reading your texts, comments, so no worries. All right, so shall we begin? Right now it's 5:37 in the evening. So let's begin our session. So as I always mention, I would love to start all my sessions with a gratitude towards you people, because you people are literally making a live session a lively one. So thank you so much for always being here. Thank you so much for always supporting us with your feedback and comments and everything, suggestions and everything. So thank you so much. So let's begin our today's session. So once again, welcome to yet another live session from Tiju's Academy, that is OET Writing Live, presented by Tiju's Academy, and this is Aishwarya. All right. Yes, Shalom, Akhila, good evening. Yes, Mary, Anish, good evening. Good evening, everyone. Yes. All right. I hope you people are ready. Shall I begin the session? Shall we begin the session? Are you people ready to get into our live session? If you people are ready, let's begin. Yes. Anna, Neetu, Liba. Yes, very good evening, everyone. Raghi. Hi, Raghi. Good evening and welcome to our session. All right. So, today also, I just came up with a case note where we can see the OET case note in a different aspect. നമ്മൾ പ്രീവിയസ് ഡേയിൽ ഡിസ്കസ് ചെയ്ത ആസ്പെക്ട്സിൽ നിന്നും കുറച്ച് ഡിഫറെൻ്റ് ആയിട്ടുള്ള അല്ലെങ്കിൽ വേറൊരു ലെവലിലുള്ള ഒരു കേസ് നോട്ടാണ് നമ്മുടെ ഇന്നത്തെ സെഷന് ഞാൻ പ്രിപ്പയർ ചെയ്തിരിക്കുന്നത്. യെസ്, ഹായ് ആനി തോമസ്, ചിത്ര സജീഷ്, അനിത ബിനീഷ്. Very good evening, everyone. All right, so here is the Case note for you people. Alright, shall we begin this one by one? So you are a nurse working at the pediatric department of Brookdale Hospital. So you are a nurse by profession. So your designation says you are a nurse. And in which department? At the pediatric department of Brookdale Hospital. Alan Terry is a teenager admitted to your floor for severe abdominal pain. So who is the patient over here? Alan Terry is the patient. And when it comes to patient details, name Alan Terry, DOB, that is given as 13-year-old. So the patient is just 13-year-old. And his address is also mentioned there. Alright. So what all things can be gathered from this particular area? ഇതിൽ നിന്ന് നമുക്ക് എന്തെല്ലാം കാര്യങ്ങൾ gather ചെയ്യാം? Only from the area that we have read so far. നമ്മൾ ഇതുവരെ വായിച്ച ഏരിയയിൽ നിന്ന് എന്തെല്ലാം കാര്യങ്ങളാണ് നമുക്ക് gather ചെയ്യാനായിട്ട് പറ്റുണ്ടാവുക? Yes, Deepa K. Chandi. Good evening, Rinku Mariam. Hi, good evening, Rinku. Welcome to the session as well. You are a nurse working at the pediatric department of Brookdale Hospital, and Alan Terry is a teenager admitted to your floor for severe abdominal pain. So here we can identify that Alan Terry is a patient over here, and our designation is a nurse. All right. And when it comes to the patient age, he is just 13 years old, and patient address is also there. And when it comes to the social background, he is a middle school student, live with parents, they work, non-smoker, no alcohol. Smoke cheyanilla, alcohol use cheyanilla. They are not using alcohol or the smoking as well. So we don't even need to mention this part. We can strike off these kind of information. Instead of striking it off, I would like to mention it as IR. IR means irrelevant. Yes, exactly. So Ragi has came up with the idea that patient is a minor. Exactly. He is 13 years old. So patient endana oru minor aanu. No means no to add. Exactly. Yeah. No means not to add. Yes, Deepu, Rashmi, good evening. Okay. Alright. So we can consider this third point as an irrelevant matter. And Raki has mentioned it is a patient is a minor. Exactly. Patient ennu parayunnathu 13-year-old aanu. Appo avaru endana minor aanu. So my question to you people is ഏതാണ് എത്ര ഏജ് തൊട്ട് ഉള്ളവരെയാണ് നമ്മൾ മൈനർ ആയിട്ട് കൺസിഡർ ചെയ്യുന്നത്? ഏത് ഏജിലുള്ളവരെയാണ് നമ്മൾ ഒരു മൈനർ പേഷ്യൻ്റ് ആയിട്ട് കൺസിഡർ ചെയ്യുന്നത്? So could you please tell me how can introduce? Ma'am, 13 years, how can introduce? Yeah, we can mention it in the referral line as aged 13 years. Below 16, exactly, Achama. Below 16 patient are considered to be minor. Till 15 years, all right, or up to 17, master. You don't need to mention master because if it is a minor, we don't need to use any title over there. Patient minor ആണെങ്കിൽ നമ്മൾ എന്തു പറയില്ല, അവർക്ക് ടൈറ്റിൽ യൂസ് ചെയ്യില്ല. So you don't need to use master as well. Master യൂസ് ചെയ്യേണ്ട കാര്യമില്ല എന്നിതാ. Okay, and 11 to 16. Yes, Anna, Neetu, James, up to 17. Below 15, below under 18. Okay, I am having a lot of options regarding the minor category. So nammal parayunnathu 16 and below. If it is 16 also, we'll consider it as a minor. From 17 onwards, we will take it as a major. 17, 18 and all, we'll consider it as a major. 16, 15 and 14 and rest all those things we'll consider it as a minor. Okay, here the patient is 13-year-old, so the patient is a minor. Exactly in the FILA, 16 and below is considered to be a minor category. So, itra nammal patient ne kurichu. When we get a case note, what we can do is collect some basic information regarding the patient. Here also we got some basic information. That is, the writer is a nurse and the name of the patient, the date of birth of the patient or the age of the patient, and he is a middle school student who lives with his family. Atrom കാര്യങ്ങൾ നമ്മൾ collect ചെയ്യാൻ time. Now, straight away move on to the writing task. Let's see the writing task. Using the information given in the case note, write a letter to Dr. Sylvia, the patient primary pediatrician. In your letter, briefly outline Alan Terry's history and current condition. Address your letter to Dr. Richard Sylvia, pediatrician, Advocate Medical Center, Lehman Road, Lunenburg. So, to whom we are writing the letter? ആർക്കാണ് നമ്മൾ ഈ ലെറ്റർ എഴുതുന്നത്? Or otherwise I can ask you, who is our reader? Are you people able to identify our reader? Yes, Manju, very good evening. Welcome to the session. I'm happy to see you here. All right. So who is our reader? So can you please identify the reader? Using the information given in the case note, write a letter to Dr. Sylvia, Dr. Richard Sylvia, exactly. Pediatrician, that's the designation of the doctor. Advocate Medical Center, that's the profession, is Dr. Sylvia. Lehman Road, Lunenburg. All right, good evening. Yes, Tindu, good evening to everyone. Yes, very good. So you people identified the reader also. So here we are going to write the letter to Dr. Richard Sylvia, the pediatrician. That is the designation of the reader, and the rest of the address are also provided there. So my next question to you people is, did you people identify any other relevant information from the writing task? Writing taskil ninnu ningal vera edengilum information identify cheytho? Did you get any other relevant information from the writing task? Using the information in the case note, write a letter to Dr. Silva, the patient primary pediatrician. In your letter, briefly outline Alan's history and current condition. Address your letter to Dr. Richard Silva, pediatrician. Exactly, guys. This is a non-case. Very good. Very good. Achama, Liba, Amuda, Manu, patient's primary pediatrician. Yes, exactly. It's a non-case. So, patient in the primary pediatrician. എന്ന് നമ്മൾക്ക് അങ്ങനെ നമുക്ക് കണ്ടു കഴിഞ്ഞാൽ എന്ത് നമുക്ക് ഐഡൻറ്റിഫൈ ചെയ്യാം? ദാറ്റ്സ് എ നോൺ കേസ്. പേഷ്യൻറ്റിൻ്റെ പ്രൈമറി പീഡിയാട്രീഷ്യൻ, പേഷ്യൻറ്റിനെ ആദ്യമായിട്ട് അല്ലെങ്കിൽ ഫസ്റ്റായിട്ട് ഡീൽ ചെയ്ത പീഡിയാട്രീഷ്യൻ്റെ ആ ഒരു പീഡിയാട്രീഷ്യനാണ് വി ആർ റൈറ്റിംഗ് എ ലെറ്റർ. സോ ദിസ് ബിക്കംസ് എ നോൺ കേസ്. ക്ലിയർ? Is it clear for you people? Yes, Anita, Manu, thank you. Yes, you're always welcome, Manu. And Anita, Parvati, Manju. Yes, it's a non-case. Yes, Sushama, it's a non-case. So, I hope you people got it. So, നമ്മൾ writing taskil നിന്ന് ഇവിടെ എന്ത് ഐഡൻറ്റിഫൈ ചെയ്തു? It's a patient primary pediatrician. So, that's a non-case എന്ന് നമ്മൾക്ക് മനസ്സിലാക്കാം. So, patient's GP, his or her GP, or patientൻ്റെ പേര് പറഞ്ഞിട്ടുള്ള GP, or otherwise when we are comparing the address of the patient with that of the reader, അത് രണ്ടും സിമിലർ ആണെങ്കിൽ അങ്ങനത്തെ കാറ്റഗറിയിലൊക്കെയാണ് നമ്മൾ എന്ത് ചെയ്യുന്നത്? നോൺ കേസാണ് ഐഡൻറ്റിഫൈ ചെയ്യുന്നത്. And here then one more additional information, that is if you are seeing that patient primary pediatrician or the primary physician, പേഷ്യൻറ്റിൻ്റെ പ്രൈമറി ഒരു ഫിസിഷ്യൻ ആണ് അല്ലെ പീഡിയാട്രീഷ്യൻ ആണ് എന്നൊക്കെ കാണുമ്പോൾ അതിൻ്റെ അർത്ഥം എന്താണ്? പേഷ്യൻറ്റിൻ്റെ ഫസ്റ്റ് ടൈം ഇവർ ഒരു പ്രാവശ്യം എന്ത് ചെയ്തിട്ടുണ്ട്? ഡീൽ ചെയ്തിട്ടുണ്ട്. പേഷ്യൻറ്റിൻ്റെ ഫസ്റ്റ് ലൈൻ ട്രീറ്റ്മെൻറ്റ് കൊടുത്തേക്കുന്ന ആളിവരാണ്. സോ അവർക്ക് തന്നെ ലെറ്റർ എഴുതുമ്പോൾ ദിസ് ബിക്കംസ് എ നോൺ കേസ്. All right, I hope you got it. And let's go for the plan as well. Psychiatrist saw patient. Patientനെ ആര് കണ്ടു കഴിഞ്ഞു? Psychiatrist saw the patient. Assessment. What is the assessment over here? Assessment is with a query depression. So here the assessment is with a query depression. And recommend admission to pediatric psych ward for assessment. So what is the requirement over here? എന്തിനു വേണ്ടിയിട്ടാണ്? What is the purpose of this pediatrician? For assessment. So we got the purpose word as well. Plan, admission later in day, update patient primary pediatrician. Exactly, Achama. Assessment and management, that can be the purpose of the letter, obviously. And here in the plan also, it is mentioned that update patient primary pediatrician. So we just need to update the pediatrician, which means the pediatrician already know the rest of the history. We just need to update the current medical status. I hope it is clear. Is it clear so far? Yes, exactly. Assessment and management. Assess ചെയ്യാൻ വേണം അവർക്ക് എന്ത് ഉണ്ടാവാം obviously pediatrician ആണ് so they are supposed to manage the situation also. Yes. All right. Now let's see this case note one by one. So as we mentioned earlier, the name of the patient is Alan Terry. Assessment and management for depression. Amuda, that is not right because assessment and management for depression. Depression or assessment and management. Depression ആണ് already നമ്മൾക്ക് അറിയാമെങ്കിൽ if we already know that the patient is having depression, then what's the need of going for assessment? So assessment and management for depression is not a right usage over there. All right. Yes, Binu, Josh, good evening everyone. Sushama, update the current health status. Yes, that is what we need. Okay, yes, Alphonse. All right. So when it comes to the patient name is there. Date of birth is also there. Date of birth in the sense here it is provided as age. So age is there. Patient in the social background. He is a middle school student and lives with parents in the Koda Jivikino. And the parents work. Parents rendu peru endu cheyana. They are working professionals. Let's see the rest of the things. Family history. Father is a diabetic since age 53. Mother has depression since age 35. So, yes, Anita, suspecting symptoms of depression. That is, to somewhat it is right. Hi Shirley, yes, welcome to the session. So when it comes to the family history, father is having diabetics and mother is having depression since age 35. So avരുടെ അമ്മയ്ക്ക് already എന്തുണ്ട് depression ഉണ്ട്. Past medical history of the patient. Childhood asthma till 5 years. ORIF, open reduction internal fixation for fracture of thigh bone in 2004. Presenting complaint, severe abdominal pain. Childhood asthma till 5 years. 5 വയസ്സ് വരെ ഉണ്ടായിരുന്നുള്ളൂ. So is it necessary now? Do we need to go for that particular case? And father is having diabetic. Do we need to go that also? So these kind of things can be considered as irrelevant because childhood asthma was there till 5 years, which means the patient is not having it now. So that can be considered as irrelevant data. ORIF, that's a fracture. That's a treatment management for a fracture. That is also happened in the year 2004. That is also considered as a irrelevant data. That also can be considered as an irrelevant data. Yes, Bindu ma'am is here. Good evening, ma'am, and thank you so much for being here. For always being here. And the next one is presenting complaint. So what is the presenting complaint here? Severe abdominal pain. So the patient in the presenting complaint is severe abdominal pain. Hi everyone. Yes, Benny, very good evening and welcome to the session. Okay, so now let's see the rest of the things. The treatment summary says, on 5th October 2021, presented with mother to ED with severe abdominal pain for 2 days. So the patient is having severe abdominal pain for 2 days. That is the presenting complaint. And generalized dull pain on palpation. That is something that patient is having. Generalized dull pain on palpation. Unsure of any triggers, was playing video game. Unsure of any triggers. They don't know is there any triggering factor is there or not. They are not aware of that. Was playing video games at home with sister. So the patient was playing video games at home with his sister. Lab shows mildly high WBC. So the patient is having mild increase in WBC number. Mildly high WBC. Admitted to inpatient pediatric flow. So it becomes an admitted case. It becomes an admitted case and the admission date is 5th October 2021. So the patient presented with a mother into the emergency department and the presenting complaints are severe abdominal pain and generalized dull pain on palpation and unsure of any triggers, was playing video games at home with sister and she is having, the WBC condition is slightly elevated and because of this admitted to patient pediatric flow. So it becomes an admitted case. All right, yes, exactly, Anita. No need to write past history because doctor already knows. Yes, it's a non-case. Now, moving on to next day. 6th October 2021. On the next day, patient started on ibuprofen, still moderate pain, started Zoyzine for suspected appendicitis. Mother remains at bedside. So patient നമ്മൾ എങ്ങനെയൊക്കെ manage ചെയ്തു? What are the management that we have provided? We treated him with both these medications. And on the subsequent days, തുടർന്നുള്ള ദിവസങ്ങളിൽ, on 10th October 2021, patient pain subsiding, patient pain കുറഞ്ഞു, better mood, patient father visited. So he was visited by his father. Ward nurse mentioned loud arguments. Ward nurse എന്ത് മെൻഷൻ ചെയ്തു? അവരുടെ റൂമിൽ നിന്ന് loud arguments. They are having loud arguments. അവർ പറഞ്ഞു. As Liba was treated with ibuprofen and Zoyzine as well. സോഷ്യൽ ഹിസ്റ്ററി ആയതുകൊണ്ട് എന്താവശ്യമില്ല? നോൺ കേസ് എന്താവശ്യമില്ല? നോൺ കേസ് ആയതുകൊണ്ട് സോഷ്യൽ ഹിസ്റ്ററിയുടെ ആവശ്യമില്ല. സോ ഞാൻ ഇവിടെ ഇറലവൻ്റ് എന്നേ മാർക്ക് ചെയ്തിട്ടുള്ളൂ ഷർലി. ആൻഡ് ഫാമിലി ഹിസ്റ്ററി ഓൾസോ ഐ ഹാവ് മെൻഷൻഡ് എവറിത്തിങ് ആസ് ഇറലവൻറ്റ്. ഓക്കെ, സോ നമ്മൾ എന്ത് മാത്രമേ നോക്കുന്നുള്ളൂ? പ്രസൻറ്റിങ് കംപ്ലയിൻറ്റ് മാത്രമേ നോക്കുന്നുള്ളൂ, ബിക്കോസ് ഇറ്റ്സ് എ നോൺ കേസ്. ഇപ്പോൾ ഫസ്റ്റ് ഡേയിൽ നമ്മൾ കണ്ടു. ഓൺ ദ നെക്സ്റ്റ് ഡേ വി സ്റ്റാർട്ടഡ് വിത്ത് സം ട്രീറ്റ്മെൻറ്റ്. ആൻഡ് ഓൺ ദ ഫോളോയിങ് ഡേയ്സ് പേഷ്യൻറ്റിന് സബ്സൈഡ് ചെയ്തു. കണ്ടീഷൻ എന്തായിട്ടുണ്ട്? ഡിക്രീസ്ഡ് ആയിട്ടുണ്ട്. മൂഡ് ബെറ്റർ ആയിട്ടുണ്ട്. But what happened was, patient was visited by his father and the ward nurse reported that they had loud argument. They were having loud arguments between them. Patient agitated eye, later claimed pain worsened, teary eyed. ഒരു ആർഗ്യുമെൻറ്റിന് ശേഷം patient irritated ആയി. Then he claimed that, or then he reported that he is having again pain and he was teary eyed, he was crying. And after 3 days, pain decreased. Patient is better spirit. പിന്നെയും എന്താണ്? പേഷ്യൻ്റ് ബെറ്റർ ആവുകയാണ് ചെയ്തത്. So discuss the possible discharge with mom. So as we saw the progress in patient condition, what we did was, we did the possible discharge procedure and everything with his mom. The patient listened to that. Patient അത് കേൾക്കുകയുണ്ടായി. And the patient cried, claiming pain was more. Then after listening to that discussion, the patient simply started crying by mentioning about the pain and everything. Spoke to patient directly about going home. So we had a conversation. We had a discussion with the patient directly regarding the discharge. So what happened was, the patient admitted ചെയ്തു. എന്ത് admit ചെയ്തു? Troubled relationship with father. So he admitted that he and father are not in a very good relationship. അവർ അഡ്മിറ്റ് ചെയ്ത കാര്യം എന്താണ്? അവർക്ക് നല്ല റിലേഷൻഷിപ്പ് അല്ല എന്നുള്ള കാര്യം. They admitted that both him and his father, yes, exactly, അവർ എന്തുണ്ടായി? They are having a troubled relationship. Yes, situation changed, patient disturbed. Then mother also confirmed the relationship is strained. Mother in the confirm ചെയ്തു. What all things that we have gathered from the patient is absolutely right, because this particular patient is not having a very good relation with his father. Patient's father is unhappy about son's poor grade at school, punishes regularly. So what is the issue between them? He is not having a very good score in school, and because of that the father is unhappy. അതുകൊണ്ട് തന്നെ ഫാദർ എന്താണ്? അൺഹാപ്പിയാണ്. Father unhappy about son's poor grade and punishes regularly. All right? So അതുകൊണ്ടാണ് അവർ തമ്മിൽ എന്തുള്ളത്? They are having an unhealthy relationship. So assessment says abdominal pain, a somatic symptom of depression with a query. So what they have understood is, the patient is not having any, the patient is not having any he is having abdominal pain, and this can be a somatic symptom of depression. അത് എന്തിനുള്ള ചാൻസ് ഉണ്ട്? ഒരു സൊമാറ്റിക് സിംറ്റം ഓഫ് ഡിപ്രഷൻ ഉള്ള പോസിബിലിറ്റി ഉണ്ട്. ദാറ്റ് ഷോസ് ദ ക്വയറി ഓവർ ദെയർ. ഓൾ റൈറ്റ്? All right, so somatic symptoms of depression. So psychiatric consultation requested. So in the request ചെയ്തു, psychiatric consultation അവർക്ക് request ചെയ്തു പേഷ്യൻറ്റിന്. And on 14, that is the last day, psychiatrist saw the patient. Assessment is also like, query depression. ഉറപ്പായിട്ടും അവരെ ക്വയറി ചെയ്തോ? Are they confirmed that situation? No, they are still having doubts. So that's why this particular psychiatrist refer this patient or asking the patient to go back to his primary pediatrician. So that is the condition. So here, what we have to identify, we have to be very careful with many things. Patient primary doctor, which means it's a non-case. That is something. So since it's a non-case, we can eliminate family history, past medical history, and the social history as well, because it's a non-case. And in the plan also, the assessment goes with a query, which means it is not confirmed. So we have to confirm, and the primary pediatrician is the one who is supposed to confirm the condition. That's why we are sending him for assessment with the pediatrician. All right, അത്രയും കാര്യങ്ങൾ നമുക്ക് മനസ്സിലായി. And look at the nature of this particular case note. It started with severe abdominal pain. It started with a physical condition, and there were variations in his WBC level and everything. So it started with a physical condition, but after a point of time, it changed his nature. Physical condition mari patient in endundayi, it started to become a mental or a psychological or level അല്ലെങ്കിൽ ഒരു emotional ലെവലിലേക്ക് അത് മാറുണ്ടായി. Started with a physical condition, but later on it changed into an emotional level. That's why the patient is suspected to have depression. So I hope you people got the point. Yes, exactly, Neetu. Suspected. So I hope you people got an idea regarding this condition. Your case note ellavarkum clear ayo? If it is clear for you, then I do have some questions. All right. So I hope it is clear. The clear aano ningalku? Do you have any doubts regarding this particular case note? Okay, yes, clear. All right. So now it's time for you people to start with some very basic question. So I want to ask you a basic understanding regarding this particular case note. I am having, a very basic question for you people. So it's your time to start responding through your comments in our comment box. Okay. So the very first question is, what does a query indicate in the case note? Avade endundu? Avade oru query undu. So what does it indicate? Option A, diagnosis. Option B is possible diagnosis. Option C is doubtful condition. Yes, so what is the answer? Yes, everyone. B, possible diagnosis. So people are going with doubtful condition as well. Okay. Yes, Mary Anish says it's diagnosis. Okay, all right. കുറച്ച് പേരെന്ത് പറയുന്നു, ഇത് ഡയഗ്നോസിസ് ആണെന്ന് പറയുന്നു. കുറച്ച് പേരെന്ത് പറയുന്നു, ഇത് ഡൗട്ട്ഫുൾ കണ്ടീഷൻ ആണെന്ന് പറയുന്നു. ഓക്കെ, ഓൾ റൈറ്റ്. All right. Okay, diagnosis, doubtful or suspected to have. Doubtful condition. Okay, possible diagnosis. Jasmine says it's a possible diagnosis. Alphonse says it's C, doubtful condition. Okay, all right, diagnosis. Okay, Akhila says it's B. Little then says it's A. So I am actually, reading your comments, and I got all the three options. Okay, 3 options എന്ത് ചെയ്തിട്ടുണ്ട്, കിട്ടിയിട്ടുണ്ട്. ഓക്കെ, സോ ഇവിടുത്തെ ക്വയറി എന്താണ് ഉദ്ദേശിക്കുന്നത്? ഓൾ റൈറ്റ്, യെസ്, ഓക്കെ. Yes, he may have depression, doubt, suspected to have the condition. So I'm getting all kind of responses over here. All right. Possibility of depression. Okay. Possible diagnosis. So be very conscious with the terms over there. Possible diagnosis, doubtful condition. So be very conscious with the term that they have used in here. Possible diagnosis is depression. Exactly. Beena Bhaskar, B, C, possibility of depression. Exactly. So I am getting all the three options. So since there is a query, which means we are not sure of the situation. Situation namak endalla sure alla. So sure allathathu konda it cannot be considered as a complete or 100% diagnosis. അതൊരു 100% ഡയഗ്നോസിസ് ആയിട്ട് നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റില്ല, കൺസിഡർ ചെയ്യാൻ പറ്റില്ല, ബിക്കോസ് ദർ ഇസ് എ ക്വയറി ഓവർ ദെയർ. സോ ബിക്കോസ് ഓഫ് ദാറ്റ് വി ക്യാൻ എലിമിനേറ്റ് ദ പെർട്ടിക്കുലർ ഓപ്ഷൻ ദാറ്റ് ഇസ് ഡയഗ്നോസിസ്. നമുക്ക് എന്ത് ചെയ്യാം, ആദ്യം തന്നെ ഡയഗ്നോസിസ് എന്ന് പറയുന്ന ഓപ്ഷൻ എലിമിനേറ്റ് ചെയ്യാം. ഓൾ റൈറ്റ്, നൗ ദ സെക്കൻഡ് വൺ, ദാറ്റ് ഇസ് പോസിബിൾ ഡയഗ്നോസിസ് ഓർ ഡൗട്ട്ഫുൾ കണ്ടീഷൻ. ഇവർ തമ്മിലാണ് നിങ്ങൾക്ക് എല്ലാവർക്കും ഒരു മേജർ ഒരു കോൺഫ്ലിക്റ്റ് ഞാൻ കാണുന്നത്. സി, look at the case note first. ഇവിടെ എന്താ പറഞ്ഞിരിക്കുന്നത്, assessment. They already made an assessment and the assessment says depression with a query. So they tried to do a diagnosis over there and the diagnosis is with a query. So that shows it's a possible diagnosis. This can be a possible diagnosis. So depression can be the possible diagnosis of this condition. ഡൗട്ട്ഫുൾ കണ്ടീഷനേക്കാളും ഇതാണ് ഏറ്റവും ഓൾറെഡി ഒരു അസസ്മെൻറ്റ് കഴിഞ്ഞത് കൊണ്ട് അവിടെ എന്താണ് ഏറ്റവും സാധ്യതയുള്ളത്, ഈ ഒരു ഡയഗ്നോസിസ് ആണ്. ദാറ്റ് ഷോസ് ദ ക്വസ്റ്റ്യൻ മാർക്ക് ഇൻ ദി കേസ് നോട്ട്. ഐ ഹോപ്പ് ഇറ്റ് ഈസ് ക്ലിയർ. സോ ആൻസർ ബി ഇസ് ദി റൈറ്റ് വൺ. ഇസ് ദാറ്റ് ഓക്കെ ഫോർ യു പീപ്പിൾ? ക്ലിയർ ആണോ? If it is clear, shall we move on to our next question? Here is the second question for you people. That is, if the patient is a female child aged 16, which title is appropriate with the name? If the female child is a patient, if a patient is a female child aged 16, patient is 16 years old and it's a female child. Here Alan is a male child, right? So we are asking, the question is about if the patient is a female child who is at 16 years of age, what will be the title? What will be the possible title if the patient is a 16-year-old? Dhanya goes for C. Rinku. Binila is going for B. Okay, C, no title. Miss Mary is going for Miss. Okay, Miss, no title. All right. So even if the patient is female, if the patient endana male aanu, but adoru female patient aanu, and if she is 16 years old, we don't need to use any title. So the right answer is no title, because 16 and below, 16 and below are considered as minor. 16 അതിൽ താഴെയും നമ്മൾ എന്തായിട്ടാണ് കൺസിഡർ ചെയ്യുന്നത്, ആസ് എ മൈനർ, which means no need of title. Clear? Yes. Even male or female, no need of title if the patient is 16 or below than that. If it is 17 and above, we have to add the title according to the gender. Clear? I hope it is clear for you people. All right. Now let's move on to the next question. Which date format is preferred in the body of the letter? So we do have 3 date format over here. Option A, B and C. So which date format is preferred in the body of the letter? What is the date format that is preferred in the body of the letter? Option A, B. Stephen is going with B. Okay. Mady is going with B. A. Option A. Yes, I'm getting multiple options. A and B are the 2 options that is coming up on the comment box. C arundana choose cheynilla, which means you are having confusion with A and B. Okay, so which date format is preferred in the body of the letter? Then I would say option A, because among the other, this is considered to be the standard one. And if we are writing this particular letter, if we are writing the letterhead date in this particular format, your format il thanne aanengil namakku endana ഈ ഒരു ഫോമാറ്റിലാണ് ലെറ്റർ ഹെഡ് ഡേറ്റ് യൂസ് ചെയ്യുന്നതെങ്കിൽ അവിടെ ബാക്കിയുള്ള ബോഡിയിലും എന്ത് യൂസ് ചെയ്യുന്നതായിരിക്കും ബെറ്റർ? 14 October 2021. All is okay. Yes, 14 slash ഇട്ട് എഴുതുന്നതും തെറ്റല്ല, point ഇട്ട് എഴുതുന്നതും തെറ്റല്ല. പക്ഷേ better to go for the first option. This is the better option. മറ്റേത് തെറ്റാണ് എന്ന് നമ്മൾ പറയുന്നില്ല, but this is considered to be a better option. Yes, exactly. Follow this date throughout the letter. Exactly. We are writing in a format in the letterhead and try to follow the same format of the date throughout the letter in order to maintain the uniqueness of the letter. Clear? I hope it is clear. And here is the ഇതുവരെ എല്ലാവർക്കും ക്ലിയർ ആണോ? അപ്പോൾ ലെറ്റർ ഹെഡിൽ എപ്പോഴും ഈ ഒരു ഫോമാറ്റ് ഫോം ചെയ്യുന്നതായിരിക്കും നല്ലത്. യു ക്യാൻ ഫോളോ ദ സെയിം ഫോമാറ്റ് ദാറ്റ് വി ഫോളോഡ് ഇൻ ദി ലെറ്റർ ഹെഡ് ത്രൂ ഔട്ട് ദ ലെറ്റർ. Now let's move on to the next one. Which keyword does not indicate the purpose in an update letter? Which keyword does not indicate the purpose in an update letter? ഒരു അപ്ഡേറ്റ് ലെറ്ററിലെ പേർപ്പസിനെ കാണിക്കാത്തത് ഏത് വേർഡാണ്? പേർപ്പസുമായിട്ട് ബന്ധമില്ലാത്തത് ഏത് വേർഡാണ്? റെഫർ. ഓക്കെ, ദാറ്റ് ഈസ് ഫൈൻ. അവരുടെ പേർപ്പസുമായിട്ട് ഒരു ബന്ധവും ഇല്ല. Inform, refer, regarding, okay, everyone is, I am getting all three options now. Inform is there, refer is there, regarding is there. All right. Okay guys. Yes, Deepa, Jasmine, Sandra, Amuda, Anita, Rinku. Yes, everyone is going with A and B, refer and inform. Which keyword does not indicate? Purpose-നെ indicate ചെയ്യാത്തത് ഏതാണ്? Milan Khada, yes. Neetu, Little Jen, Anu, everyone is going with inform. Which keyword does not indicate the purpose in an update letter? All right. So the answer here is regarding. Regarding is the word that does not indicate the purpose. See, informing the patient. See, when we are, I am writing to update you regarding. But here, what was the question? Question എന്തായിരുന്നു? ഇതിൽ ഏത് കീവേഡാണ് നമ്മുടെ പർപ്പസിനെ ഇൻഡിക്കേറ്റ് ചെയ്യാത്തത്? See, when we are writing a letter to anyone, നമ്മളൊരു ലെറ്റർ ആർക്ക് എഴുതുമ്പോഴും we are trying to inform them. അല്ലേ? നമ്മൾ അവരെ എന്ത് ചെയ്യാനാണ്? We are trying to make them understand. We are trying to make them informed regarding the condition. So the purpose of a letter is obviously inform വരുന്നുണ്ട്. Refer എന്ന് പറഞ്ഞാലും in a way, we are referring this patient back to the same person, right? We are giving this patient back to the same person. So we are sending them back to the same person. So avade endana, it is not an introduction for the first time, but it is a referral over there, right? നമ്മൾ അവരെ തിരിച്ച് refer back ചെയ്യാണ്. So the word keyword that does not indicate the purpose means regarding. Regarding എന്ന് പറയുന്ന ഒരു പേർപ്പസ് ഏതെങ്കിലും ലെറ്ററിന് വരുമോ? So regarding is the right answer in this particular context. Is it clear so far, girls? അപ്പോൾ നമ്മൾക്ക് വരുത്താവുന്ന ചെറിയ മിസ്റ്റേക്സ് നമ്മളിവിടെ മാറ്റിപ്പോയത് കണ്ടോ? അപ്പോൾ നമ്മൾ ലെറ്റർ ഒരു കേസ് നോട്ട് കിട്ടുമ്പോൾ we have to identify the very fine basic details as well. In regard to this correct or not, ma'am? In regard to this, regard നമ്മൾ ലെറ്ററിൽ ഇൻട്രൊഡക്ഷനിൽ എഴുതാറുണ്ട്. I am writing to update regarding the current status of the patient എന്ന് നമ്മൾ പറയാറുണ്ട്. I am writing to update you regarding the current health status of Mr. X അല്ലെങ്കിൽ Miss X എന്ന് പറയാറുണ്ട്. പക്ഷെ regarding എന്ന് പറയുന്നത് ഒരു പർപ്പസ് വേർഡ് ആണോ? That is our question. Regarding, is it a purpose word or not? Regarding is not at all a purpose word, right? That is the question over there. I hope it is clear, Milan. All right. So that's all for you people regarding the questions. Now let's see the letter for your better understanding. So So the final sample letter for your understanding. What is the date over here? ഏത് ഡേറ്റ് ആണ് നമുക്ക് ഇവിടെ ചൂസ് ചെയ്യാവുന്നത്? ഫസ്റ്റ് ഡേറ്റ് ഇവിടെ ഉണ്ട്. ദിസ് ഈസ് ദി അഡ്മിഷൻ ഡേറ്റ്. Admission date. All right, Milan. Okay, so what was your question? Milan was asking me in regard to this is correct or not. In regard to this, I didn't understand where you are using that particular phrase. So if you can make a proper sentence with that particular phrase, then I will make a correction on that, if there is any. And when it comes to this particular question, the question was about identify the purpose word. So identify the purpose word was the question. We have to identify the non-purpose word or the words that we don't use as a purpose. So refer is a purpose word. Inform, we are informing the patient. That is also a purpose of writing letter. But regarding means it's not a purpose. I hope it is clear now. Okay, yes, I'm reading your messages, guys. So നമ്മൾ ഏത് visit ആണ് choose ചെയ്യുക? Here in this particular case note, the patient is admitted on 5th October. Then there is markings regarding 6th October, 10th October, 13th October, and the last one was 14th October. So we can use the last date as the letterhead date. That is provided here, 14 October 2021. And to whom we are writing the letter? That is Dr. Richard Sylvia. What was her designation? Pediatrician. So the designation is pediatrician. And the address is Advocate Medical Center, Lehman Road, Lunenburg. This is the letterhead date. Letterhead date. And all these things shows reader's address. And here is the salutation for you people. How we can write the salutation? Dear Dr. Silva. Exactly. So read letterhead is it there. Reader's address is there. It's important to mention this, the designation of the reader, followed by the salutation of the letter. Dear Dr. Silva. We skip the first name of the reader. Then the referral line, Alan Terry, 13 years old. Alan Terry is a minor, so there is no need of title. This is a referral line. Sinsa, Shinto, Lipa, yes, very good guys. Now let's see the introduction. Since it's a non-case, how we can construct? Ma'am, in updating the letter, can we write any other introduction? It's always better to go for update if it is a non-case, because that is the correct wording when we are writing a non-case. I'm writing to update you. We just need to update the reader. Regarding what? Regarding the current health status of. What is the name of the patient? Alan Terry. Since patient is a minor, we don't need to go for any title. Who requires? What we need? A psychiatric assessment. That is what we can get from the writing task, or I would say the plan. Psychiatric ward for assessment. Recommend admission to pediatric psychiatric ward for assessment. So what they need at this moment is psychiatric assessment. And what is the condition? He is suspected to have depression. Patient in a condition endana suspected case aanu. Endonnu case cheyunu depression undannu parayunu. So since it's a non-case, we can eliminate social and medical history. So straight away let's start with the body paragraph, the presenting complaint. On 6th October 2021, Alan was brought to the emergency department. With what type of complaint? With a 2-day history of severe abdominal pain without any trigger. So they don't have, this patient is not having any trigger, and this patient is having abdominal pain for the last 2 days and with a severe abdominal pain. And where he approached us and he was brought to the emergency department. Okay. On examination, so when a patient approaches, what we do, we'll go for examination. On examination, he had dull pain and investigations revealed mildly elevated WBC. So അവർ പറയുന്ന കാര്യം എന്താണ്? On examination, he is having dull pain and investigations revealed mildly elevated WBC. So how we managed the situation? We provided him with ibuprofen and Zolstan. We provided him with some medications. So we simply informed the reader regarding the presenting situation. He came for a severe abdominal pain and we went for some examination. Then we got the test report and we managed the situation with the medication as well. This is about the first paragraph. Now let's move on to the next paragraph. On 10th October 2021, Alan reported. What he reported is an improvement. He reported improvement. So the Alan himself reported that he has improved. He feels better after the hospitalization. However, he was agitated and tearful following his father's visit. So what happened was, his father visited him, but after that he became agitated and tearful. He was simply crying after his conversation with his father. He later stated that his pain had worsened after a loud argument between them. So what he told us that father and the kid is having a loud argument and his pain is increasing. Because of that, the pain is increasing. This is what happened in the second day, or the 10th October 2021. Not the second day, on 10th October. 3 days after that, after 3 days means 10 plus 3, 13. Alan made good progress. Alan had a good progress. He started crying, but later on he again started crying. All of a sudden, he was feeling good, but all of a sudden he just broke out his emotion. He started crying, claiming that his pain had become worse. So he claimed that okay. All right, Sunitha, I will address you that question. So I will explain that particular paragraph, then I'll come to your question. Okay. So 3 days later, what happened was Alan made good progress. But later after the progress, he again started crying. And he claiming that his pain had become worse. So what he is crying and telling us is his pain is becoming worse. So on discussion. So what we had is a discussion with the patient. We had a discussion with the patient and he admitted. He started crying. Crying means he continuously crying. And along with that crying, he is claiming. He started crying, claiming that his pain had become worse. അവൻ കരഞ്ഞുകൊണ്ടിരുന്നു. ക്ലെയിം ചെയ്തുകൊണ്ടിരുന്നു ഹിസ് കണ്ടീഷൻ വേഴ്സ്ഡ് ആയി. അപ്പോൾ അവിടെ എന്താണ്? ക്ലെയിമിംഗ് ആണ്. ഓൺ ഡിസ്കഷൻ, സോ വാട്ട് വി ഹാഡ് ഇസ് എ ഡിസ്കഷൻ വിത്ത് ദ പേഷ്യൻറ്റ്. He admitted to have. So the patient admitted that. Here it's not a hospital admission, but the patient agreed. The patient agreed that he is having a strained relationship with his father. Strange means something is not in a well manner. That's a distorted relation, not a good relation. So he admitted to have strained relationship with his father. His mother also confirmed the situation. And what's the reason behind that? His father is unhappy about his son's poor academic performance. He is not good with his studies. So that's why his father got upset and he started scolding his son. And this is causing some kind of emotional or psychological deflations in patient's situation. So what his father does is, his father is unhappy about his son's poor academic performance, which often lead to punishment. So very often he'll punish him. Consequently, what is the consequence? His abdominal pain was assessed as a somatic symptom of possible depression. All right? Consequently, and crying Yes, after that there is a comma over there. He started crying, put a comma, claiming that his pain had become worse. നമ്മൾ രണ്ടും കൂടെ ഒരുമിച്ചല്ല എഴുതിയ. He started crying, then we put a comma, then we get off with the next sentence that is claiming that his pain had become worse. So pain അങ്ങനെ ആയി. So he admitted his poor relation with his father. His mother also confirmed the scenario. And what is the scenario? The father is not satisfied with his academic performance and often punishes him. So consequently, his abdominal pain was assessed to have a somatic symptom of possible depression. So the condition was assessed as what? As a somatic symptom of possible depression. All right. So what do you mean by somatic symptom? Somatic symptom is nothing but, the patient is feeling physically down, physical condition because of any other underlying reason. Here the patient is having depression, but because of that depression, what he feels is, or what he expresses is abdominal pain. So that kind of scenario is called as somatic symptom. What is meaning of claiming? Claiming means avagashappeduga. He claimed that. അവൻ പറഞ്ഞു കരഞ്ഞുകൊണ്ട് അവകാശപ്പെട്ടു അവൻ്റെ പെയിന് കൂടി എന്ന്. Is it clear, Shirley? And Nevi Subi, hi ma'am, വിച്ചിന് മുന്നേ കോമ വേണോ? Please reply. വിച്ചിന്, okay, on discussion, he admitted to have strained relationship with his father, which was confirmed by his mother. So why we asked a comma over there? Normally, if it is a normal sentence, we don't need to go for a comma, but this is considered as an extra additional piece of information, right? He admitted to have strained relationship with his father. That is the main sentence. And this is an additional one with a proper confirmed by his mother, right? So avada nammalku endu use cheyam? Clear use cheyam. Claimed or claiming avade vanam. He started crying. avan karayan thodangi. Along with that, crying-ന്റെ കൂടെ തന്നെ അവൻ എന്തു ക്ലെയിം ചെയ്തുകൊണ്ടിരുന്നു? His pain had become worse. Okay? So അവിടെ എന്ത് നമുക്ക് കൺഫേം ആയി? His abdominal pain was assessed as a somatic symptom of possible depression. And today, Alan was consulted by a psychiatrist. So what happened on today's date? Psychiatrist saw the patient. So what happened was, the patient, today Alan was consulted by a psychiatrist and suspected to have the condition. So he suspects that the patient is having the condition. What condition? The condition that mentioned in the introduction, that is depression. So what we have to do is, so this particular reader, what he has to do, it would be appreciated if you could provide further assessment and treatment for Alan. That is the discharge plan, DP. All right? So, and the concluding line, please contact me for further information. And the ending close, yours sincerely. Okay, so yours sincerely. And the registered nurse or the nurse. That is the designation. I hope it is clear for you people. This is how we can write this particular case note. So the key point that we can take out from this particular case note is primary pediatrician. Patient primary pediatrician is a non-case. And with the query, it's a suspected. You want to see the purpose? Purpose here is psychiatric assessment. That is mentioned here. Recommend admission to pediatric psychiatric ward for assessment. So what he needs is a psychiatric assessment. Alan has made good progress in Nano. Okay, so yours sincerely, Liba, there is no need of adding apostrophe there. We won't put apostrophe in yours. So yours sincerely, this is the right usage. And someone else was asking me which name we have to, who was it? Sunita Gadwal was asking me which name we have to follow. The patient name is Alan Terry. Since the patient is a minor, we can use the first name of the patient in the body paragraph. Since the patient is a minor, we are using the first name of the patient in the body paragraph. Okay? Yes. Has made good progress. Which is more appropriate, pediatric nurse or nurse? Not pediatric nurse. Okay, pediatric nurse. If it is mentioned as nurse here in the, here it is mentioned as a nurse. So you can go for nurse. Okay, Rakhi? And Raji Ajay was asking, Malan, has made good progress aano choichal. Has made നമ്മൾ യൂസ് ചെയ്യുന്നത് if it is mentioning on today's date. Today Alan നല്ല progress ഉണ്ടെങ്കിൽ we will mention it as what we can do is, if it is we are talking about today's progress, then we can mention it in present perfect tense, that is has made. But here this is 3 days later, 13th la കാര്യമല്ലേ. Today's date is 14. So I wrote it in simple past. Alan made good progress. I hope it is clear, Ajay. Okay. So this is the first line, followed by the second piece and the last piece. So this is all about our today's case note. I hope it is clear for you people. Okay, if it is mentioned as a pediatric nurse, then you can go for pediatric nurse. But in this particular case note, it is simply mentioned as nurse. Alright? So go for nurse. Shiny, yes, I think this is the first page that you are asking for. Or the letter first page. This is the letter first page as well. Alright everyone, so that's all for today. So I'll meet you people on next weekend. So thank you so much for being here throughout the session. Thank you everyone. Thank you so much.